I want to begin with this upcoming World Health Organization report. Obviously, the world is watching and anticipating very closely. What can you tell us about the possible origins of this virus based on the findings that you and your team made?
Well, there is a lot of new information that's going to come out in this report, probably in 10 to 14 days from now, including data on the first clusters of cases in Wuhan, on the animal links to this virus, and on the genetic sequencing that's been going on in China around this virus. One thing's clear, that this outbreak did seem to be centered on Wuhan. It seems to have been very explosive in the second or third week of December. And there are clear links from the market in Wuhan, the Huanan seafood market, through the wildlife farming network into animals that carry coronaviruses in the wild. We don't know for sure that that's the pathway, but it's looking more likely at the end of this.
Can you talk to us a little bit about the access that you had? There was some concern. You may have seen some European scientists had reservations about what type of access your team had, whether the Chinese officials were forthcoming in the material and the information that you requested. Can you shed some light on that process?
Yeah, I mean, this was a joint mission, as WHO calls it. China is a member of the World Health Assembly, and they voted for this mission to happen. But of course, they're fully aware that the eyes of the world are watching this and looking to find an answer for where this virus originated. Look, I think we got pretty incredible access. We got into the labs that had been targeted as a potential source of the outbreak. We got into the market where the first cases were found. We met with some of the first known patients of COVID that survived. We asked questions that weren't vetted beforehand, and we got answers, and we judged based on those answers and the data we saw what we think the most likely pathway this virus took was. That's as good as you can do at this point in terms of a WHO international collaborative effort. And I think the world will be surprised at how much detail came out of this mission.
So when your team was putting this report together, sir, was there any key points that the World Health Organization team and Chinese scientists disagreed over? Was there any pressure from the Chinese government or other outside actors about how this report should be put together?
Oh, the pressure was there from day one, especially from the rest of the world looking in. We saw the press pack every day on every trip that we went on, every field site mission. But I think what we saw internally between the WHO team of experts and the scientists working for the China side were scientific debates around the origins. We saw the data, we discussed it, we debated it, we said, what does this mean? And really what we found were some unanimous conclusions that it's unlikely, extremely unlikely, that this virus escaped from a laboratory, that it's possible that the so-called cold chain hypothesis that frozen food could be playing a role in some of the outbreaks, but far more likely is this pathway from wildlife into farmed animals, in this case, wildlife farms, into people in Wuhan. And I think everyone agreed on most of those major conclusions, which is a significant, a positive sign.
So you would safely say that it did not originate in the laboratory, as some have suggested, that it did not originate from the Wuhan Institute of Virology. You can rule that out based on what you've seen.
No, we're not ruling it out. What this report says is it possible? Is it likely? Is it unlikely? And our conclusion was it was extremely unlikely. Lab accidents do happen. They tend to happen when viruses are kept in cultures where there's lots of viruses present. There didn't seem to be those cultures present in the Wuhan lab. There's no evidence that there was any virus closely related to SARS-CoV-2 in culture in that lab. And the lab is very well run. I mean, we talked to the managers, we talked to staff, and it's a new, efficient lab. It just seems extremely unlikely.
So looking ahead, are there any findings in your report that public health leaders will be able to apply to dealing with the rise of COVID-19 variants, which is obviously a major cause of concern right now?
Well, I think that the lesson for us really is on a bigger time scale. We're seeing more and more pandemics, emerging diseases like COVID emerge. They tend to emerge where people make contact with wildlife reservoirs of disease. We need to deal with the pathways and shut them down. that allow these pandemics to start. The variants are yet another sting in the tail of this pandemic. And I think that if we really want to prevent this sort of thing happening again, we've got to get into preventive mode. We've got to start looking at these pathways that are risky and shutting them down. You know, China closed down the wildlife farms that were supplying food to markets like Huanan Seafood Market back in February during the middle of the outbreak. There's a reason for that. It was good for conservation. It's good for public health. We need to shut down these pathways on a global scale, and then we'll never see pandemics. We'll never see variants of pandemics either.
Hey, thanks for watching our YouTube channel. You should know that you can follow today's top stories and breaking news and catch up on your favorite MSNBC shows all in one place. Download the NBC News app today.